Hello and welcome back. Welcome back to Diverse Conversations. This is Ashka Patel. Thank you very much for joining me yet once again for another insightful and inspiring episode. Today we're going to be speaking with a health tech leader, Howard Rosen, who is the CEO of NovaInsights and also founder of LifeWire Corporation. Howard has more than 30 years of experience as a founder and leader of diverse, successful companies in the healthcare and entertainment industries. He has created, organized, and directed the development of innovative businesses that produce technology and communication solutions for clients and partners that include Fortune 500 companies, U.S. public sector, military, and civilian. A strategic visionary leader with an eclectic professional history of developing and delivering high-value products and services that enhance customer experiences while producing business opportunities and revenue channels. Howard's recent accomplishments include being named Fellow of Columbia University Business School HITLAB. He has written 9 articles for Forbes and is also part of the Forbes Business Council. As a member of the Business Council, he has completed Level 2 Innovation Board Governance and has been awarded his 7th utility patent. He has also been chosen to represent Canada by the Canadian Embassy in Philadelphia on multiple occasions to mentor other businesses in the development and delivery of innovative healthcare IT solutions, and has delivered presentations before the United States Capitol Hill Steering Committee on Telehealth, as well as he is chosen as one of the 100 Next Century Innovators by the Rockefeller Foundation. So it gives me immense pleasure to welcome Howard to our conversation today, where we'll be unpacking the future of health technology and just where Howard sees the future of digital health. And, as healthcare providers, what are some things that we need to keep in mind as we're innovating? So with that, let's welcome Howard to this conversation. So welcome back. And now we have Howard joining us in this conversation. Howard, thank you so much for making the time to, come onto this platform to share your insights. And truly, I think it's an honor that we share, that I at least am very humbled that you took this time to come onto this platform and, share your incredible insights with us. So thank you so much for making the time to be here today.
Oh, that's very nice of you, Aska. I'm really looking forward to our discussion.
Thank you. Likewise. And I think before we even get started into the core of the conversation, I would love to hear a little bit more about your journey, in terms of how did you start into this world of digital health and just your career trajectory, because a lot of the times the audience is always looking for some inspiration in terms of what are the different career pathways that are available. And I think what you have achieved, we do need to spend a few minutes to talk about this, because I would love to hear what your career path has been like.
Yeah, not too sure what inspiration as opposed to confusion, perhaps. But very quick, and I know in terms of the very quick story,
yes,
is by education, I have an MBA, International Finance and Marketing.
Okay.
So naturally with that, I spent about 15 years producing film and television, which in doing so, I came up with an idea for actually creating a communication platform for patients and providers. Which I started, which is about 18 years ago now.
Wow.
Started as a solopreneur, then an entrepreneur, then building an organization that did work with the public sector and private sector, military and civilian, and which I hold now actually 7 patents, which I just sort of say to show how crazy sometimes a trajectory can be.
Yes.
And then about a year ago, having built the company and after 15 years of having led it as a CEO, I thought, I think it's time to let's kick in some of the succession and some younger blood kick in. And so I've now created NovaInsights, which is a company I'm running now, which is a consulting company, taking all that I've learned from all 3 areas as an MBA, from film and television, and as a health vendor and health IT. Dealing with strategic innovation and digital transformation in particular.
Absolutely. Thank you very much for that quick rundown. But I think just, hearing you kind of share that diverse experiences from film, television production to kind of in communication is just amazing how the pieces come in together to, so beautifully find a purpose in life, right?
Yeah. I'm not too sure about purpose, but certainly a direction. But the commonality to it all, and which is why it's so important to what I'm doing now, and I know for our discussion, is fundamentally it's still about people. Yes. And it's about engagement. Every element. As an MBA, I was trained to engage customers. In film and TV, my job was to engage an audience. And really what my communication platform was designed to do is engage providers and patients to have better communication with each other. And literally in terms of the digital transformation issue, which is core to it all, is it's fine to have all these toys, but they've got to be used. And how
Yes.
they're built into respective healthcare systems so that they are used to the benefit of everybody in that ecosystem, but in that really that the stakeholders involved in it all.
So agreed. So true as well, because, as a healthcare provider myself, and I can only relate to that in terms of how important communication is, especially when it's being received by patients and making sure that, they actually understand what exactly that they need to do to, keep their health to the best levels that they can. I will definitely come back to that, but I also wanted to take a moment to also understand a little bit more about the innovation you created about the communications piece that
Platform.
you're exactly. Yes. If you could speak a little bit about that as well, please.
Oh, sure. Fundamental to it all. And again, because I was sort of this dumb, arrogant film producer, dealing with, I was actually working with one of our divisions dealt with doing CMEs, and one was
Right.
GlaxoSmithKline. So we actually were doing a CME on type 2 diabetes.
Uh-huh.
And it was sort of seeing how pervasive it was. And we're talking 15 years ago, and how pervasive it was going to be.
Right.
It was kind of like going, well, what's happening? What's happening? I had 4 young kids at the time saying, this is going to be a huge problem they're going to be dealing with.
Yes.
And there are a lot of great solutions, but nobody was using it, like 18% or something to that effect. And so, as I said, being a card-carrying arrogant producer, kind of, well, all you got to do is come up with a solution that engages people.
Yes.
And then they'll get them into the system to want to start involving themselves in their own healthcare.
Agreed. Thank you very much. Thank you for sharing that.
So I didn't mean to interrupt, but the crux of that is back to communication and engagement. Is there's always this barrier. You have to use this gadget. You had to communicate this way. So what my idea was that led to the communication platform was take those barriers away. Let the individuals choose how they want to communicate. So whatever device that they want, whatever software that they want, whether it's email, text, WhatsApp, whatever the case may be, that they're the ones that were choosing how to communicate. So instead of being told how to communicate, they chose it. And you took away the first fundamental barrier to that communication. Yes. And I'm sure you experienced it with some of your clients and patients going, oh, I got to download this app to do this. And already the eyes fog over.
Exactly. And that is, it's critical also because it also then, kind of gauges their engagement, right? In terms of how engaged will they be with us for that service that they're receiving from us as well. So thank you so much for creating. Thank you so much for inventing. I know it was a space that you were not necessarily familiar with, but as you mentioned, it's about how can you innovate so that you're addressing some of the problems that you're seeing in our day-to-day lives, and they don't necessarily have to be in our area of expertise, but it's a willingness to at least learn. I know. Sorry, were you saying something?
No, I was just agreeing. Absolutely, that's very much the case.
Thank you. Yeah, and I know you have extensive experience in Canada and in the U.S. In terms of working with companies and businesses in various different sectors and industries. But you have a very huge focus on digital health and health tech. So if I could tap into that experience of yours, how do you see the digital health innovations differ between the two countries, especially Canada and the US, even though we like to think we're similar, but I would love to hear it from you in terms of what your thoughts are on that.
Well, the health systems are different.
Yes.
Though actually more similar than we realize between the systems, but the approach is a little different. In terms of technology, the technologies are there. In fact, some of my biggest competitors in the United States were Canadian companies.
Wow.
So the innovation, the technology, and the insights are there. It's more how do you address the respective healthcare systems to get utilization of the various products. And I said, I don't make a secret of many times we're sort of saying the biggest frustration a lot of Canadian companies have is the difficulties of getting into sort of the silos of the healthcare system up here. And at times it's easier in the United States more because it's a much broader, 10 times the population.
Yes.
But their approach is where they have federal programs across the entire, for health across the system, and there's state across, and there's local, and there's state. So many layers you can access of areas of where the solutions can be of benefit.
That's true. That's true. Thank you very much. So it's really always very intriguing for me to hear that the innovation kind of happens in Canada and gets
Yeah,
implemented in the US, right?
absolutely. There's a tremendous amount of innovation that occurs here.
That's amazing, and it's mind-blowing at the same time because it's like something we don't give ourselves enough credit for, at least,
That's part of being
it's
Canadian.
yeah, exactly, being the humble self that we are.
Exactly.
So with that in mind, and I agree with you though, and I feel like we're slowly waking up to this whole digital health tech revolution here in Canada, especially during the pandemic. We started this innovation. What are some trends that we can anticipate in this space, especially here in Canada, over the next 5 years or so?
Well, it's Canada and the US. I think it's everywhere in terms
Hmm.
of the pandemic certainly accelerated the utilization of certain tools.
Right.
I think you need the realization for people to realize digital health, as always, pieces. They're not solutions, they're enablers. Back to the
Hmm.
discussion about engagement. So it's how do you enable the patient? How do you enable the clinicians and the providers and the nurses and the techs and the caregivers to
Right.
give the better care or to get the better care that they're looking for? And I think what's going to happen is there's no question we've seen the consolidations. We saw massive investments last year and then sort of a
Yes.
lot of them tanking this year. So, but as a result, though, there are still a lot of very robust solutions. And I think what we're going to find is greater collaboration amongst the vendors and the solution sets to be able to provide a much more robust enabling approach again, for the patients and the providers.
Absolutely, absolutely. And thank you for sharing those insights because I know one of the biggest obstacles or challenges that we always talk about in the digital health tech space has been interoperability and the ability for, apps on different systems to
Mhm.
kind of communicate and data share and whatever else that is. I know it's a it's a big question that nobody really has an answer, but I'll ask you a question anyways because I see you as an expert in this area. Do you think Canada is able to potentially create an interoperable digital health tech network if we were to, let's say, start all having these collaborations and whatnot? Is
There's
that
no
possible?
Oh, absolutely. There's no reason why not. He said the technology is here
Mm,
as it is elsewhere. So the tech exists and the knowledge exists and
right.
the insights exist. That's not an issue at all. It really becomes more, is it the willingness and a true willingness of the single payer that we each face?
Yes.
And then the master payer being,
Yeah.
the federal government to actually really find a way of sitting down to do that.
Absolutely. And I know, like, even on the provincial levels, every province has a different map in terms of how they wish to digitize their healthcare systems, right? So
Exactly.
even in Ontario, like, not too long ago, over a decade or so ago, we had a plan that was hopefully to be implemented and it got scraped entirely. And now we're taking a rejig at it again. So, but I also feel like, from a patient's perspective, an interoperable system would be the best solution for them in terms of making sure that they get the most comprehensive care by ensuring that all that data, all that information about that patient is easily accessible.
Well, that's it.
Um,
It's accessibility of that information. And the patient,
exactly.
as a patient, I don't really care what technology is there. I just want
Yes.
to know I can go on my app or on my screen and I get all my information. My x-rays are here, my bloods are here, the notes are there.
That's true. And again, sometimes it's also like, we do not necessarily, as patients especially, like we may not understand that this is why interoperability is important. But it's when we're receiving the care, then that's when you understand that, oh, this is why it's important. And I feel like, these kind of conversations will hopefully help shed that light, especially to healthcare providers,
Mhm.
because as healthcare providers are mostly the ones who are listening to this podcast. But I'm hoping that, we'll start to think of these as we're innovating is, how can we make sure that we are more connected, more
Yeah,
accessible to each other, so that we are creating a more comprehensive network for our patients.
absolutely.
And that brings me to
That's
your LinkedIn profile has a very interesting tagline, and I'm going to quote your profile on this because you
oh,
mentioned humanizing digital health, digital transformation, and what better field than healthcare to really for this to be very applicable, right? Because we really are here to help support our patients, but at the same time adopt this digital revolution that's kind of taking place in the background. What are some challenges you see in digital health innovation and implementation that are currently present, and if there are any solutions that you could propose to them?
well, talk about challenges. How long is this podcast? Um,
We can keep it as long as you want it to be.
you gotta be careful of that. No, really, the fundamental part of it is the transformation to date, or how, and when we talk about digital transformation, it's really how do you just go involve digital solutions.
Hmm.
Like it's not this big grand thing, but just how do you involve these grand solutions? The problem has been that for the most part, it's been under the IT group
Mm,
and it's been bolted on and say, okay, we now have this digital front door, go to town
right.
and use it. Or as an example, or they've, not that it, whether cast any aspersions one way or the other, or they're now an Epic system, and here's my chart. Go to it and spend the next 2 hours every day implementing information.
Yes.
But it's just bolt it and come, and there is not any involvement of the patient or the provider, anyone in that system. And so you have an industry average of about 10% success when it comes
Mm,
to digital implementation, digital transformations.
yes.
Uh, and actually, I'm publishing a report tomorrow that I just did a poll about exactly that, and it's confirming everything else.
Wow.
McKinsey and CGI have come out with it, and just my own informal, well, semi-informal group that I'm publishing tomorrow talks about the same thing about that digital transformation, the difficulty of it, and fundamentally, to me, it's not involving the stakeholders.
Yes.
And part of it is just because you can do something doesn't mean you should do something.
Hmm.
So as a provider, I'm sure I don't know, you're being faced with now where you had some information about a patient. It's
Yes.
now a fire hose of information. So the one piece of that puzzle that's missing for the providers is how do you discern the data that you need so you have actionable information?
Yes.
And even more so, what's the context of that data so it's actionable? Is this 10 minutes old? Is it a day old? Is it 3 months old? And in what conditions were they, was it collected and compared to what? So we have data points,
Hmm.
but I think what's missing for be of value are all those contextual side. And fundamentally, you don't have that when you don't involve the stakeholders from the outset in the design and for the collection and the usability of it all.
Absolutely. Speaking of usability, I think it was just in 2021 there was a report out by Harvard Business Review, and they were saying that EHRs have like the least. They were given a grade F because like they were the least usable of
Mm-hmm.
all the different digital innovations that are out there, which kind of makes us question like exactly what you mentioned is how are we designing these and how are we innovating in
Exactly.
this sector to make sure that the stakeholders who will actually be the users of these systems,
Yeah.
their opinions and their perspectives are taken into account. Thank you very much for sharing that because as a healthcare provider and somebody with an interest in the digital health tech space, I always make myself available, but it's always good to know that innovators like yourself are also working with healthcare providers as you're creating
Yeah.
these innovations, right? Because it's a core, I believe, a core necessity, and it should be. It should be a core necessity. With that said,
Without question. Yeah.
sorry, go ahead.
So without question, it's again the arrogance. And it's not just healthcare, but across the board in terms of a lot of innovations or
Mm,
businesses or products. It's I'll build it and they will do it without
yes,
talking to the users.
yes.
So
And you know
I
what?
do a lot of. So I was saying. So what I do a lot. What I take from a film world is
Yes.
what I've always done is a lot of focus groups. So at
Hmm.
every step of the way, I involve the stakeholders and do literally focus groups.
And I
And
think
it
those are
drives
very,
and it
sorry.
drives my sorry, and drives my IT guys crazy. And they go, well, they're doing it wrong. And they go, no, 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 no. They're doing it how they're doing it.
Yes.
We're setting it up improperly to address the fact this is how they're going to use it.
Agreed, agreed. And you know what? That is so true. And I'm glad you shared that because I also have been noticing, like, I think we're in this rat race of, trying to be the first innovator or trying to take that, the first place credit of I was the first one to do this. But
Mhm.
I also feel like that sometimes compromises the quality that you wish to offer,
Absolutely.
right?
Yeah.
Because you're not then doing like the focus groups. Focus groups can take time, right? Especially if
Yeah.
you're the way you're doing them, like at every step of the way.
Yeah.
I'm sure it takes you considerable amount of time to come up with that innovation, and no wonder you have 7 patents under your name is because you are researching this field before you're kind of saying here we have something ready like as a product.
Yeah.
Speaking of your patents and as a healthcare provider, it's always something we are very clueless about because we're like, what do we do about this? And I do see you as a reputed innovator. You have done some incredible work. What is an advice that you have for new innovators, as they're building new technology and venture? I know you kind of mentioned about the focus groups. Any other advice you wish to have in terms of how can they create more quality, innovative products?
Well, it does come back, talk to the end user, fundamentally, and when to provide, and the end user is not just the patient. They said to me, you've got that continuum of care. So the end user is everybody, every touch point in utilization of that product to go from beginning to end. What is the objective? But in terms of the innovation, an innovation ultimately is, are you actually solving a problem?
Right.
So it's be clear what the problem is that you're trying to solve. And in part because as you're being an innovator, everyone around you tell you you're crazy. And actually, the more they tell you you're crazy, the probably the closer you are to being onto something.
Oh, that's smart.
But that's kind of where it's at. But make sure, but be really clear as to what problem you're trying to solve.
Yes.
Because that builds up the veracity of what that solution is, that innovation is.
Right.
And also don't be afraid to look outside of the industry. Like the reality is 80% of innovation in any industry comes from outside the industry.
Yes.
So, there's a lot of examples outside in terms of, for inspiration to repurpose it. Obviously, you can't use specifics in terms of that, but it could be inspired by that. But as I said, it goes back to being what is the problem being solved.
Thank you very much, Howard. I think that was some great insight. And I think somebody who is trying to innovate or bring a new product to life, I think they will definitely benefit from that advice. So thank you very much for sharing that. And also just a question around, since we're speaking of patents very quickly, what are some things that somebody should consider if they're, deciding whether to pursue a patent or not? Or is any advice in that area for you that you may have?
A patent, I looked at a patent as frankly a marketing tool, because I went into it I was reluctantly going when I filed for my first patent. Is actually very reluctant to do that, in part because it's still an expensive process to go through, and ultimately a patent is only as strong as you have the finances to defend it.
Right.
But you need that consideration. But in the middle, it's looking at to say a patent is valuable to sort of indicate, is there something unique in what you've developed in your idea, in your whether utility or business process, and has great value as you're going forward. Working with prospective clients, especially if you're a small business, going, look, I have this, I got a patent, so at least there's something unique about it.
Yes.
And indicative of being unique. So it has that kind of value. It does have value, frankly, when you're going for contracts.
Yes.
And it talks about, do you have the intellectual property rights, to do so? And if you're able to go, well, for this particular thing, I uniquely have this idea. Again, it's a valuable business product to have.
Right. And thank you again. I think, this whole world of patent is something new for me as a healthcare provider, for sure. And your insights are definitely very helpful. Shifting gears a little bit, because I know I also wanted to take some time to also kind of acknowledge the work that you do at HIMSS Ontario chapter. I know this year you were, appointed the position of president at the HIMSS Ontario chapter, and I would love to tell us a little bit more about that, because a lot of healthcare providers may not be very familiar with the work that's being done at HIMSS.
Yeah, well, HIMSS again, as you, I know you're familiar with, is actually a global organization. There's actually over 120,000 members. There's over 50 chapters. There's over 550 nonprofit healthcare system, as members of it all. Ostensibly, it's trying to help really their words are to reform healthcare. I see it as a chance to sort of, frankly, create a community of healthcare providers, of healthcare vendors, really the entire ecosystem, particularly in digital health, to really share best practices and to share insights, to really help move the ball forward, and also to educate, to sort of see where things are, where they're going. Because, there's so many misconceptions as to what technologies exist, what can and cannot be do, what can happen, what the effects of certain technologies are, and even where, in terms of legislation and regulations. Where do things stand as to what we can do as either, myself as a vendor or was a vendor, but in terms of the providers, what they can do. So we really work to try to create a community of across the sector of different individuals that can actually help build everyone else in terms of their understanding and a place to go. They go, oh, okay, I've got some peers who get me, because that's a whole other ballgame.
Yes, absolutely. And I know HIMSS Ontario and HIMSS, the global organization, they also hold those annual conferences as well. So something is a great way to network and meet.
There's tremendous, because there's tremendous resources for education and research. There's a phenomenal resource for connecting with peers. Like I said, they had the global conference. Well, this year it's going to be, this is going to be in April in Chicago. We just had ours in Toronto last week. And the idea is to continue to build on that and build on that community.
Absolutely.
And as I think I'd like to think you saw at the conference last week, is just how the breadth of the kinds of, to your question, of the innovation that exists and the breadth of the discussion that exists and how robust it is. And we're trying to build that out, and we're continuing trying to build and bring on more people to expand on that, and the thought leadership and the content creation in that area.
Absolutely. And I look forward to, seeing how that organization is able to support the Ontario community and Canada and globally as well, because, under your leadership, I have no doubts that we'll be seeing some great content coming out. And, I encourage everyone to check out and reach out to Howard if you have any questions around that as well, around the work that he does as well. With that said, before I let you go from this podcast, I do always ask this question because this is kind of what we started this podcast with. But just how do you envision the future of the digital health tech space over the next 5 to 10 years? And how do you see healthcare providers' roles potentially changing with that revolution of sorts?
Well, it's interesting. First of all, I think the real success is when you don't call it digital health, you just call it health. It's just how we deal day to day. So that's the first change I think you'll see.
Okay.
And on the other side, in terms of your comment about how providers will change,
how their practice may change.
I don't think the practice will change, except to the extent you have better valuable data and more actionable data. Patients will have more information. They're still going to go to Dr. Google and everything else. You can't avoid that. But I think you'll have a better informed patient group, because they're going to have their devices, whether the watch or their phones or whatever the case may be. But so they'll be more informed. And as a result, I think the providers similarly become more informed, because they'll both have that actionable data and information. I think interactions will be more, I think you definitely have a hybrid of the practice will be partial telehealth.
Right.
Whether it's on the phone or a screen or whatever.
Yes.
And in person. But I think there'll be delineation where the in person are those people you actually, for the most part, you really need to see in person.
Got it.
As opposed to those many things can be dealt with on a 10-minute interaction on the screen. And so I think you're going to get a cleaner delineation and a greater comfort of that.
Awesome.
The biggest barriers to that, particularly up in Canada, is the codes. Are we going to give you the right codes to do that? And what logically needs to happen?
Absolutely.
So you've got the balance. So to your question you opened up with, you have the issue is going to be, you've got the bit of a friction right now between the technology and the tools that enable healthcare and the speed of which the pay system encourages or discourages that.
Yes, absolutely.
And that's a comparison to the United States and Canada, where the United States, it's a bit broader as to what you're able to do and do the billings on versus what you can do in Canada. But again, given your 5 to 10 year time horizon, I do think that's going to balance out, and that's going to shake out. And we're in everyone's sort of recovering from the pandemic and what that entailed and the costs associated with it.
Yes.
Because the problem with healthcare costs, it's not a next month ROI. It's a long-term ROI, and I think it's back to the educating of those that are in the positions on the paying side, is understanding the long-term investment required and the value you get.
And I agreed with you. Thank you very much for painting that future. You have definitely, got me intrigued by when you said digital health will just be health, and I'm like, whoa. But it's actually true because, little do we realize it now, but we're already integrating how we communicate, even not just for health, but any other purpose.
Anything else? Yeah.
There's different modalities we're using and choosing, and again, it's just becoming part of the way we behave and our patterns, right? So thank you very much for those insights. That is, wow. I'm just in a shocked phase right now because it's a future. I'm like, wow, this is I look forward to that future, to be honest. Because as a healthcare provider, I would love to have that flexibility in terms of how I engage with my patients.
Exactly.
And how my patients can engage with me, right? Instead of
that goes back to, again, that whole engagement side. Let the people who are involved choose that means, because you get rid of that barrier.
Yes,
and
exactly.
Then once you get rid of the communication barrier, you're now actually dealing with the business of health.
Yes, absolutely. And before I let you go, one advice you have for emerging innovators, especially healthcare providers who are looking to innovate in the digital health tech space. We'll call it digital health tech now, just to make sure we kind of keep a focus on what we're talking about. But one advice you may have for them.
Well, really, I think we touched on it during the discussion. Is that, please let your minds go, because again, a goofy guy like I can sort of come up with these ideas, and it's been my honor to the extent it's actually helped a lot of individuals.
Yes.
You want to make sure, so let your imaginations go, because you're closer to the ground than even people like myself were, as to what the needs are, but be clear what the need is. And in terms of what it goes back to, what's that problem you're solving? Right. Or the concern that you have, or what you want to address. And it doesn't have to be a big innovation. It could be a very small change in something, that if you change your workflow, that instead of it taking 20 minutes to do, it's 5 minutes, that's massive, as you know, in terms of time. So the innovations don't have to be big, crazy, lights flashing everywhere. It can be very small little piece of innovations, but it's still got to come back to what is the problem that's being solved. And then the other side of the coin, unfortunately, because of the business side, is you're solving a problem, but is there an ROI? Is there a return on investment on that problem? What is the money return? Is it savings in time? Is it savings in dollars that's resulting? If it's just innovation that's cool, that's great. But it's going to be, sadly, you won't be able to necessarily build a business around that.
Right.
I'm just saying that as just that heads up, because you asked for me for it, is just a heads up that there is that side to it, because just having the innovation for the sake of innovation, that's good and valuable, unfortunately, is not enough that will drive if you want to do this as a business.
Absolutely. Absolutely. Thank you very much, Howard. You have shared some really good food for thought for all of us today. And I'm so grateful. Once again, thank you very much for, making the time to be here and sharing such incredible insights. But I would also encourage our listeners to make sure to follow Howard on LinkedIn and Twitter. We'll be posting his profile details in the description box along with the promotions, and make sure to reach out to him if you have any, if there is any work that he may be doing. We'll also be looking out for the report, Howard, if it's available to the public.
Tomorrow.
we'll follow you.
Yeah.
We'll follow you, and we'll keep an eye out in terms of when it becomes available. Would love to read your insights on digital health tech space as well. So thank you very much once again for making the time and being here with us. Really appreciated.
Well, thank you so very much. I really enjoyed the discussion.
Absolutely. All right. So with that, we will be signing off for today, but please feel free to follow Howard. We'll be putting his links below. Follow HIMSS Ontario. We'll be putting that link in below as well. And if there is any questions, put them in the comment boxes. We'll love to answer them to the best of our abilities. Until next time, signing off. Bye-bye.